A couple of years ago, you had a bad headache that wouldn't go away.
Yes. My story is I'm a brain tumor surgeon. This is what I do for a living. So in really April of '05, 20 months ago, but who's counting, right? I started with a headache, just a headache on the right side of my head here, almost like a tension headache. I'd rub it, it went away, felt better, take Tylenol, it'd go away, but it'd keep coming back. This went on for a month. I kept telling myself, well, it's stress from all the stuff I do and some of the political things I do nationally for the American Medical Association and others, trying to help other physicians and so on. That was all just stress. Finally, after it went on for a month, I said, okay, I'm going to get an MRI scan to prove to myself that I'm being paranoid here. I'm a hypochondriac. It's not going to be a tumor. Likely of that being a tumor is probably 1 out of 500, maybe 1 out of 1,000 for just a simple little headache that gets better if you rub it and so on. So I got the MRI scan just to prove to myself that there was nothing going on. And that's when I came out of the MRI scanner and I saw the film, and there was a tumor there.
And when you first saw the film, you thought, ooh, that poor son of a gun has it bad. And you didn't think it was yours.
That's exactly true. So I do for a living. I could tell from 10 foot away, that's glioblastoma, no question. Right temporal lobe. Whose ever MRI that is going to have a really tough time. That's about as ugly looking as it gets. That's your 50-50 chance at best of being alive 1 year after that.
When did you find out that was yours?
Well, after I saw the film and I just had the MRI scan, I walked over just to take a look at the name on there. The name at the top of that was Hassenbusch. Do you know how many times you can check a film to be sure it really is your film? I talked to the x-ray tech, and who did you do before me? Any chance maybe you switched films or something? Is that really my MRI scan?
Suddenly you were in a position of physician heal thyself.
Absolutely.
What were your options?
Well, it's pretty clear. First option is an operation. Get as much of that out of there as you can do. I was blessed, shall we say, by the Lord in that it was in one of the more silent areas of the brain, this right temporal lobe. It's an area where you can take out that whole temporal lobe and really have no deficits at all. You can't pick up any change at all in the patient. First option is to get an operation, get all of it out that they can do. Unfortunately, with glioblastoma, and the reason the numbers are so bad with it, it's not the tumor that you see on the MRI scan. Tumor cells, microscopic tumor cells, creep into the brain around it. They can creep 6 inches or more away from the tumor in the brain around it. Well, you know, brain isn't like a lung. You can take out half a lung and get by. You can't take out half a brain and get by. So the problem is you can take out the part that shows up white on an MRI scan, but those microscopic cells that have creeped out 3 inches, 6 inches away, those are the ones, given enough time, they'll turn into a tumor.
Meanwhile, one of your colleagues at MD Anderson was busy working on a vaccine for glioblastoma. You called her up, and what happened next?
You're exactly correct. Remember, my specialty had been resecting brain tumors and doing biopsies, things like that, and of course pain management. I never really had much in the way of treating the brain tumors. But it turns out one of my colleagues was developing and actually carrying on a vaccine protocol that had come from Duke University, and she had worked on it as well and extended it and had data where patients were being followed up to 2 and 3 years after resection of glioblastoma, doing perfectly fine. No recurrence, no problems, no side effects. Very simple protocol. Once a month, you get a little injection, just almost like getting your TB skin test or something like that. And it revs up your immune system, your white cells, so they sense those specific tumor cells. And anytime the blood system sees one of those tumor cells, those white cells, that's exactly, find it and zap them, kill off the tumor cells. And the results were really looking good.
So, what happened?
With the treatment that I went on, you mean? Oh, well, that was 20 months ago was my diagnosis. 17 months ago was when I had this fork in the road I decided to do, and I call it, by the way, the double whammy. You know, 2 different therapies, you put them together, you get the advantage of them, but you also get the side effects for both of them. So I call it the double whammy. Nonetheless, it's worked very well. Here I am 20 months out now. If you look at the survival curves for the vaccine study, 20 months is where the curve flattens out, meaning there's no more deaths, no more tumor recurrences. The key really milestone for me would be at 24 months. Every study, almost every study been done on glioblastoma, 24 months, no matter how bad the result, the curve tends to flatten out, which means that if you're alive, there's no evidence of tumor coming back at 24 months, it's 4 more months I got, that high chance you're going to do well long term.